much more than I might ask for them for Christmas. I asked my stepmom, she's like looking for ideas. I'm like, do you need new? And she's like, no, something else. What jewelry?
But that's what I want!
What about jewelry? No. I need new kneepads though.
You can bedazzle the...
Special guest stars.
Klaus.
I think Klaus is the best name ever.
Yeah, okay, so the blister on this foot was like, on my arch about that big. Full. And then today, because I ran yesterday and then skated on, and it was like, it's healing, and it dried and flat. But then the extra skin made like, do I need anything while I'm here? I remember last time I wore socks to derby, like knee-high socks.
Oh no. Year one. For me.
Yeah, year one.
Or no. After the second flat track, because Snappy bought me a pair of socks, so I wore them in a scrimmage so I could get a picture to show her.
Hey, was it Katie, your employee?
Yeah.
She's pretty great.
She's awesome. Yeah.
Yeah.
They're so hung up on like I have to hire somebody who's a skater and blah blah blah. Hiring somebody who doesn't skate has been like the best decision ever.
Well, and she knew, like, she...
Well, we've done a lot of
More or
training
less,
and a lot of
you know.
talking stuff, so like I mean she knows enough to handle just about anything that comes through here, except for like, you know, if there's any major bills or anything, but yeah.
She'll occasionally text me with the question.
Yeah.
You're live.
Alright. Shall we turn this off?
Yeah, let's turn this off.
You should have to see it.
Alright, we're good to go?
Mm-hmm.
Sweet. So, you guys know me, but I'm talking to the camera today. So, for those of you who don't know me, I'm Sparkle Motion, aka Claire Lacey. Professionally, I'm a senior strength and conditioning coach at the Athlete Factory, an elite performance center in Calgary, Alberta. In roller derby, I skate for the Chinook City Killjills, the Red Deer Roller Derby Association's Belladonnas, and I am head coach of the Glenmore Reservoir Dogs men's roller derby team. So far undefeated in their first season of RDA play. So I'm here today to talk a little bit about concussion in roller derby because it's an issue that seems to come up again and again, but hasn't been specifically dealt with by the community at large. We deal with it individually as leagues. We haven't brought information to the table to discuss amongst ourselves as the larger community. I myself have had 3 concussions this season. The first, early on, minor, couple days I was back at it. The second, a little more major, came with some whiplash. The third was on September 20th, and I am still not back to 100%. I actually have a appointment with a vestibular rehab specialist tomorrow to see if we can get some of the symptoms to go away. So I'm going to be talking a little bit about what's happened to me, about the information that I have had before this and that I've learned, and steps that we can take as a community to help, 1, protect ourselves as skaters, and 2, prevent further injury. One thing that surprised me is just how much concussion actually cost me in terms of lost revenue, in terms of expenses. Even though I have health insurance, the expense of chiropractic work, the expense of rehab, it adds up really quickly. Supplements that I'm taking, getting things covered at work, It adds up really quickly, and that was one thing I never really took into account prior to my concussion. So we'll go through some of that as well. But let's start at the very beginning. What's a concussion? Concussion is a form of mild traumatic brain injury. What a lot of people hear is the word mild and miss the traumatic brain injury part. It's a traumatic brain injury. What concussion is it's a mild shaking of the brain. That's what differentiates it from a more traumatic brain injury, or a severe traumatic brain injury. And it is, one, very difficult anatomically to see. So CT scans, MRI, hemorrhaging of the brain, hematomas, other anatomical structural impairments that the shaking of the brain has caused. Concussion does not need you to hit your head. It can be caused by a severe whiplash reaction. The brain is surrounded by fluid in your skull. If it gets knocked from side to side at a high enough velocity, the brain will basically bruise. Each cell in your brain, the brain is made up of neurons. They're highly specialized cells. This was explained to me. I used to work as a writer for a neurosurgeon at the University of Calgary. And although he specialized in cancer surgeries, his chief resident, Sanju Lama, was a specialist in traumatic brain injury. And so I had her explain this to me once. And the way Dr. Lama described it was, your neurons are highly specialized cells. They send impulses to the body to instruct the body what to do. Around these cells are glial cells. Those provide nutrients and protection to the neurons. There are two theories on what happened. Is one, they're stretched and that bond is strained so that it takes time for them to heal and come back together. Or two, if the shock is severe enough, they're separated, in which case the neuron dies. It cannot be repaired. At this time, they are looking into cellular therapies that will repair that. That's in the future. That is not today. That is not right now. The second description of a concussive episode, and one that seems more agreed upon in the literature, is that the neuron is connected with a connective fiber called an axon. What can happen is that axon swells and breaks. If it swells, again, there's no signal that's coming from that neuron to the cells it's connected to, so that neuron basically becomes dysfunctional. And if it breaks, there's no way to repair that. Your body doesn't produce new neurons. It doesn't produce new axons. So when this damage happens, it's permanent. Luckily, the brain is elastic. It can work around it to a certain extent, but if the trauma is severe enough, or if you've had enough concussive episodes, then the result of these ongoing interruptions to these neurons can have a cumulative effect. So it almost is impossible to say. Each concussion has to be treated separately. It's impossible to say, just by witnessing the hit, for instance, whether there's this cellular damage going on or not, or how much has accumulated in the brain. You can't tell that by scans, and you can't tell that just by looking at the person or assessing them or taking a medical history. But we do know that this damage is happening. So I'm going to read a little bit from the consensus statement on concussion in sport, which was the 4th International Conference on Concussion in Sport held in Zurich in 2012, because it is pretty much the document to go to right now for where the medical industry agrees that concussion is. Other than that, the research may or may not have a consensus. This is the consensus. So they find 4 basic constructs to define concussion. 1, concussion may be caused by either a direct blow to the head, face, neck, or elsewhere on the body with an impulsive force transmitted to the head. So that's your whiplash. Concussion typically results in the rapid onset of short-lived impairment of neurologic function that resolves spontaneously. So it might go away by itself in 1 or 2 days. That's the majority of concussion. However, in some cases, symptoms and signs may evolve over a number of minutes to hours. 3, concussion may result in Sorry, I'm having trouble with words since my concussion. Neuropathological changes, but the acute clinical symptoms largely reflect a functional disturbance rather than a structural injury, so that's what I just talked about, function rather than structure, and as such, no abnormality is seen on standard structural neuroimaging studies. 4, concussion results in a graded set of clinical symptoms that may or may not involve loss of consciousness. Resolution of the clinical and cognitive symptoms typically follow a sequential course. However, it is important to note that in some cases, symptoms may be prolonged. So the majority of concussions, they say anywhere between 70 and 80% resolve in 7 to 10 days by themselves. That's the concussions that you may have some headache, a little bit of blurred vision and dizziness, but largely the symptoms go away on their own, nothing is severe. But concussions present with a whole host of symptoms, and these are not limited to, but include emotional disturbances, so you might be feeling overwhelmed, more sad than normal, emotional, cognitive disturbances, have trouble thinking, feel in a fog, feel dazed or confused, not quite present, might have trouble answering questions or following conversations when multiple people are talking. That's one of the symptoms that I've had that is really difficult to deal with in any kind of team situation. 3, you have sleep impairment. So you might have insomnia, or you might go the other way and be sleeping more than normal. In either case, that sleep impairment is a symptom. And then, so we also might see behavioral changes where someone is all of a sudden not acting themselves. They're irritable, they're angry. These are symptoms that someone might not recognize in themselves, but the people around them might recognize. So one of the very important things is that in the early stages of concussion, you have someone present to monitor you, to provide you with your symptom analysis, because you might not be in the state you might not be in a state to. In 2 separate occasions when I've been concussed, the first one, in my first year of Derby, I lost consciousness for a very brief time. I hit the ground. I know I was out because I thought I jumped right back up, but everyone else all around me was on their knee. I had no idea what was going on. But I finished playing that game. My coach thought I was okay. Everyone else thought I was okay. I thought I was okay until 2 days later when I was still dizzy and not feeling very well. And I went, oh, I know what that is. Second time was this year in the September incident. When I was concussed, I was reacting to things. My coach didn't realize, he wasn't paying attention, he hadn't seen the incident. I had been assessed by a teammate, not a medic. Not a medic on the scene, she is a professional nurse. But the medic on the scene wasn't aware of what had happened, my coach wasn't aware, and I continued to play the game until I got so dizzy that it felt like I was playing roller derby on a rocking boat, and I was certain I was going to throw up at any minute. And that's when someone else told the coach, you can't keep putting her out. For 3 days after that, I felt like you feel that feeling when you are so drunk that you need to pass out and throw up, but you can't quite do either yet. That's what I felt like for the 3 days afterwards. And new symptoms kept emerging for the next week. I took that whole week off work, and I got numbness in my left hand, a twitch over my left eye. I was slurring words. I wasn't able to speak properly. I wasn't able to follow discussions. I was feeling lost. It felt like I had no appetite. It felt like it was too much work to prepare food. I couldn't look at a screen for more than a few seconds. The primary, and I had seen a doctor, and he told me that all I could do was rest. And when a doctor tells you to rest after a concussion, it's complete physical and mental rest. So that means that you need to turn off your screens. It means you can't be listening to music. It means that you can't be thinking or reading or watching TV. You need to chill out. Close your eyes. Sit in the dark. But I forgot that I could ask for help from my teammates and my friends, so I literally sat in a room by myself in the dark, having these emotional waves, because that's what concussion does to you, thinking that the world was ending, and oh my God, I will never play derby again. I will never be able to work again. I will never be able to think again or function again. I'll never go back to normal. And it was scary. It was insanely scary. But I was okay. The thing is that I was on my own with no one to check up on me at that point. If I had had someone to check up on me, it probably would have merited an emergency room visit at some point. So, the other thing is, if you suspect that your teammate has a concussion, try and make sure they have someone with them in the first couple of days to check up on them, to make sure that they are okay. Because if one of your teammates breaks her leg and is in the hospital, you'll think to visit. But if one of your teammates has a concussion, they drop off the radar a little bit. The teammates now might really realize what's going on. And because they're not supposed to be on screens, they might not think to tell people what they're doing. The brain's not functioning correctly. They're not thinking and feeling the way they normally would. So it's a good idea to check up. So what can we do? What can we have in place to know on the track when someone is concussed? Well, this conference came up with a baseline test. It's called the SCAT-3. It's freely available online. I'll post the link online afterwards. And what it is, I will pull up a copy. So SCAT stands for Sport Concussion Assessment Tool. It's the 3rd edition. There is a separate one for children, so for derby skaters under the age of 13, make sure you get the child SCAT because the symptoms present differently. Anyone can administer this. It is best administered by a medical professional, but it's online, it's easy to administer, anyone can do it. What I suggest everyone do as a league is get a baseline. And what that is this has some cognitive elements. You do things like, I can tell you exactly what you have to do. There is a memory test where you have to repeat a list of words. There is a concentration test where you repeat a string of numbers backwards. So if the numbers are 719, you would say 917. But if you're naturally bad at that, and you're being tested for the first time when you're suspected of having a concussion, the results might not be accurate. You might not actually see whether or not there's an impairment. So by doing this today, or tomorrow, or before your season starts, and doing it once a year as a team, you're going to have a baseline for everybody. Then when someone has a hit on the head, or has a whiplash episode where you suspect a concussion might be present, you can have someone on the bench administer this SCAT test again and compare the results. And you don't need a physical piece of paper. You can have your iPad with you. You just need if you don't have that, this is still a pretty good baseline because you go through all the symptoms. You go through balance. You go through that cognitive assessment. So by having this, you're going to have a better idea of whether or not someone's impaired by simply asking, what's the date today? They found in a study with high school athletes that most athletes with concussions, it takes, with the exception of severe concussions where they lost consciousness or had immediate amnesia, the athletes were able to respond to questions like, what is the date? What is your name? Even though they were concussed. So those questions that a lot of us think are the quickest, easiest way to tell if someone's concussed might not be accurate. So having a more thorough examination right away, it's still quick, it's not going to take you very long, but it will let you know whether or not someone is capable of return to play. If someone is presenting with concussion symptoms, it is essential you do not allow them to skate again that day. Practice, game, it doesn't matter. And I'll tell you why. Once you have a concussion that is still symptomatic, your likelihood of another incidence of concussion goes way up. I actually have the numbers. It is I don't have the numbers, but it is exponentially worse. I think it triples. It triples or maybe quadruples. Something like that. The chance that you're going to get another concussion goes up. And that second concussion, if you get it, it will last longer. You are more likely to have post-concussion syndrome, which are concussion symptoms that last over a month, or depending on your scale, some people say over 3 months. And there is a chance, it's a slight chance, that you will get something called second impact syndrome. And that second impact syndrome is scary, scary, scary. What it is immediate swelling of the brain that can be fatal. There's only a 10% chance that that second impact will occur and cause this, but is a second impact in that game worth someone's life? Is a question you have to ask. And you can't ask the skater, because they're not thinking clearly, they're excited to play, they want to be in the game. So their answer is not relevant in this situation. So I think it's a good idea to, as a league, have a written policy in place, to talk about it as a team, and to make everyone responsible, not just coaches, but fellow skaters. If you give everyone the power to say, you probably have a concussion, you should not skate the rest of this game, you're protecting your teammates. You're making this a safer environment for all skaters. The other thing I want to touch on is equipment. There is no clinical evidence that mouthguard or helmet prevent concussion. But what they do is reduce severity of blows. They diffuse impact. So a helmet and a mouthguard will prevent skull fracture, and a mouthguard will prevent jaw fracture, teeth damage, which we don't want anyways. So what are you looking for in a helmet? You're looking for a hard-shelled helmet, which means that you want something that is certified. If it's a skate helmet, you're looking for the CPSC symbol. And if it's a hockey helmet, you're looking for CSA and HECC. HECC is the American, and CSA is Canadian. So you can see, I don't know if you can see on the camera, but you guys can see that this hard shell, you can see it has almost these little nodules, right? These little round nodules. So the minute that these nodules are cracked or show any change in shape, they might swell up if they're exposed to heat in the car. That means that the helmet is no longer going to prevent impact, or prevent protection from impact. So you're looking at the inside of the helmet to see if there are any cracks or dents. You're looking at the outside. If the shell is in any way compromised, dented, or cracked, time for a new helmet. An Easton representative said that top-of-the-line hockey helmets, if you're looking at the top-shelf helmet from each of the major brands, are all within 5% in performance testing. So you can choose any of those helmets. They're rated for multiple small impacts, but a single big impact means you need to replace your helmet whether or not it shows evidence of damage. And you might say, yeah, that's pretty expensive. Those top-of-the-line hockey helmets, the one I was wearing was a Bauer React, cost $250 retail. And so that's a lot of money to put down on the helmet. But if you think of what happens to your skull when it hits a concrete floor, it's pretty cheap in comparison to the bills you might be stuck with if that happens. Plus, it will make a big mess. So worthwhile to go with top-of-the-line helmets, but recognizing that fit more than anything is going to determine the level of protection. My choice to go with a hockey helmet was purely based on fit, that I found that my head's kind of a funny shape, it's a little bit narrow, so an adjustable helmet made sure that it wasn't sliding around. Make sure you do a test. If it moves up and down, it's not tight enough. Ask a professional when you go to the store. If you're spending money on a helmet, have someone fit you. Don't rely on doing it yourself. That's what store employees are there for. I know here at NERD they're happy to help. If you go to any hockey store, they're happy to help too. I'm just going to go back to my list of some things that I wanted to talk about. So, I talked about protocol for taking someone off the field of play. What about getting back onto it? Well, most concussions, like I said, resolve themselves in 7 to 10 days. Once you're symptom-free, the best way to return to play is in a graded fashion. And this graded applies to not only returning to play, but going back to work, back to school, whatever you need to go back to. So, at the Athlete Factory, we follow the same protocol recommended in the SCAP assessment and by the consensus statement on concussion in sport. So that basically goes symptom-free, 24 hours, light aerobic activity, which means you can go for a walk, you can do a light jog, a light bike, something like that, but on a stable surface, so not skating, not a road bike, but a stationary bike. 24 hours symptom-free after that, and you can move forward into light resistance training. 24 hours symptom-free after that, you can return to your full resistance training program. On the skills side, you can attend a skills practice. 24 hours after that, you can do drills with no contact. 24 hours to follow. Contact practice, 24 hours, return to full gameplay. By doing it in steps, you're testing that your body is capable of handling changes in blood pressure, that the chemicals released when you exercise, when you get excited, aren't situations you're hitting. If at any stage you get any symptoms at all, even a headache, in those 24 hours, you return to the previous step. If the symptoms don't abate, you go back to rest and then return again. It's so important that you take even the smallest symptoms seriously because it's your brain. And you don't realize it until it's taken away how much your personality, how much things that you enjoy doing come from your brain. Laughing at jokes, getting the joke, being in on the joke. Like right now, I don't always get it. And that's unusual. And that it makes me feel not myself. It makes me feel like a stranger in my own body. So recognize that taking the protocol seriously and following it step by step is so important for recovery. And then preventing future incidents. So things that increase your chance of concussion, a few things in your history that might increase the severity of a concussion. Gender. Women are more likely to get concussion than men, and the symptoms are likely to last longer. Age. Concussions are more serious in children because their brains are still developing. The chemicals in their bodies are in a state of flux. So you wind up with different symptoms, and you can wind up with symptoms that last far longer. So concussions in children have to be taken very seriously. And in the elderly population, which we don't get many over 75 in roller derby, but I know they're out there. So just to be aware that those are some populations that are affected even more by concussion. In addition, if you have learning disabilities, you are more likely to have severity in your concussion. Same with history of mental illness or depression. So things like that, or even if the history is in your family of mental illness or depression, you could wind up with, it means you have a little bit more of a risk factor. It doesn't mean you shouldn't play, it doesn't mean you should change anything else, but just to be aware that that's important to let your doctor know in your history, and you will be asked. Doctors are good about asking about everything that might be relevant. Assessment. So basically, I've been asked a lot, when are you coming back? That's a complicated question for someone with a concussion. If you break your legs, it's really easy for the doctor to give you a timeline. With a concussion, it's a little more in flux. It depends on the resolution of your symptoms, and that's different in every single case. Because for me in the past, my concussions have never lasted more than 1 or 2 days, and now all of a sudden here I am in week 5. So I thought I'd be back by now. Turns out no. I'm still getting ringing in my ears, popping in my ears, blurred vision. If I look too fast to the side, the world goes wonky. So the amount of time that you need to take off can't be determined by a magic number. that's why the assessments are so important, because if you have not been assessed, it's hard for professionals to tell when you've returned to normal. So one thing I should say about the return to play protocol is that you should have a second scat done. So you've done your scat right when you've gotten injured, you do another one to make sure you're back to full capacity before you even start return to play protocol. That's so important to make sure your cognitive function is there, because you might feel 100%, but there might be something lingering that you don't recognize. Some neurologists say 3 concussions. Some say 5. Really, there's no number that you can assign because it depends on the impact and severity of each concussion, and it depends on your personal risk tolerance and your history, whether you're more likely to get more concussions, whether they're more likely to be more severe. So you might need to consider longer breaks if the symptoms are long. You might need to consider retirement if the risk factors become too much for you personally to take, but there's not a magic number that we can say, oh, well, if someone gets 7 concussions, our league should say they can no longer play. That's not how it works. It's a highly individual thing. And there are instances of athletes who have had 20 concussions who still play, who have no cognitive impairment, who do their jobs and are just fine. There are people who get 1 and are done and are changed forever. And there's no way to tell who will experience which. We play a collision sport. There is a high risk of contact, of collision, of damage to the head. That's something that we recognize. As we have more conversations about what should we do, well, we can start with this simple and almost free test where if we just print out some paper and take a little bit of time, we've instituted a new measure for ourselves. We can move on to say, well, now when we get medics for our bouts, we want to make sure it's someone who understands concussion and understands concussion in sport, and if someone hits their head, they have to be assessed right away. That person, that medic, or athletic therapist, or doctor, or whoever you have on the sidelines to provide your first aid, they have the power to sit people. If you give them that power, all of a sudden, it's not a coach or a skater having to make the decision for themselves. It's a medical professional who understands concussion, the severity of concussion, who recognizes concussion, who can say, you're done for this game. Going forward, we could even look at, well, what about the rules? Do we need to undertake a larger study of roller derby to see what the incidence of concussion is? And if it's particularly high, what can we do to make sure that those high blocks that happen less frequently? Because they happen, but what if we all tightened up our game? What if we all had a little more respect for those players in front of us? What would that look like? What would it look like if a high block penalty was a little bit longer than any other penalty? Not necessarily what I'm saying should happen, but ideas that I think should be discussed, because if it's on everyone's mind, then maybe we're all a little bit more aware of what's going on, and maybe we are a little more careful next time we go in to hit someone, just to make sure that we really take them out in the belly rather than in the face. Because really, if you throw your shoulder into someone's belly, they're done anyways. You don't need to hit them in the head. That wraps up about everything I wanted to talk about. Are there any questions? Molly?
In regards to the SCAT testing,
Yes.
when you take it a second time, is there any, in terms of comparing the 2 results, is there any leeway for, okay, I'm like 45 minutes into an intense derby game, I'm not going to, like, even if I'm not concussed, I'm not going to be as sharp?
That's a really good question. So they do recommend taking 10 minutes before you take the test, so that your heart rate can come down, so that you can breathe. So if I read to you the first page of the protocol, which is your basic, like, making sure you're conscious and responsive. Any signs of loss of consciousness? If so, for how long? Do you feel any balance or motor and coordination, or can I see any? Are you stumbling? Ask a few questions. What half are we in? Who was the last jammer on our team? Things like that, to check to see if they're relatively oriented. Do they have a blank or vacant look? Is there a visible facial injury? That's another big sign that there might be a concussion. And then there is the Glasgow coma scale, so if they are visibly in a coma, you can do that. Otherwise, they're probably not in a coma. And then just to even run through symptoms. You feel headache, pressure in the head, and it's a scale, so you're grading 0 to 6. Neck pain, nausea, do you feel nauseous? Do you feel dizzy? Do you have blurred vision? So those things, a skater, even in the height of game, is going to be able to answer fairly consistently. The cognitive assessment needs to wait until the blood pressure comes down a little bit. But you'll have an idea of whether or not that cognitive assessment is necessary at that point. Like I said, any symptoms present, they need to be taken very seriously. If there are, and I guess I should go through, if there's nausea, if there's loss of consciousness, if there is numbness, tingling, or unexplained weakness on one side of the body, if the pupils are uneven, if the player is having trouble answering questions, those are all signs that emergency treatment is needed now. Like I said, if the player is bleeding inside the skull, that needs to be taken very seriously and treated right away by ER doctors. Questions? Molly, you're full of questions.
I know. It's an interesting subject. At what point should you go to the hospital? So, like, you get a concussion. Okay, I'm spacey. I can tell that I'm concussed.
Yep.
When would you go to the hospital that night, say?
So the symptoms that I just listed. Let me pull out.
But if you're okay.
So repeated vomiting.
Yeah, that's
Loss of consciousness right away. A headache that gets increasingly worse over time. So if it gets so severe that you feel like it's an emergency. This might have to be judged by someone else. Extreme irritability. Stumbling or clumsiness. Slurred speech, changes in speech. And then with confusion, dizziness, it can be hard to tell. If you're questioning whether or not you should go to the ER, go to the ER. Because they're not going to be upset or angry that you've gone. And you can tell the difference between feeling a little bit dizzy and disoriented and feeling like you're on a merry-go-round going round and round and round. And at that point, that emergency care might be necessary. And it's hard to it's hard to kind of quantify, well, how dizzy is dizzy enough, or how irritable is irritable enough to warrant emergency care. With the brain, it's better to err on the side of caution and go to the emergency room, if you've got that question.
okay.
And again, the first night, it's important just checking to make sure that you are not having symptoms emerge that you're not noticing, that you can wake up when you're asked to wake up. It's a myth that you should try and keep someone awake. That is a myth. They say now that it's almost better if someone gets a little bit of sleep on their way to emergency if they've been knocked out, because then when the doctors go through the test, they'll be a little more accurate cognitively if they've gotten that little bit of sleep. But if someone is asleep and they can't wake up, 911 right away. Right. Deb, any questions, comments online?
There's a comment from Kelda 5624. Actually, two now. First, she said, my concussion was caused by a hip check that stopped my upper body moving, but my skates just kept going. Then she also comments, this is carnage, by the way.
Okay.
Is there a way to help prevent the severity of concussions after you've hit your head? As I said, my concussion was delayed, so I had no idea it was going to happen.
Okay, so once you have a concussion, to prevent further injury, you have to stop skating the minute symptoms emerge. Yeah, it's very common to get delayed onset of symptoms. It can be minutes, it can be hours. Like I said, I had new symptoms coming up for 5 days afterwards. So my concussion, my last one, I never hit the ground. I got hit on one side of the head and the other side of the head. And there was immediate ringing in my ears, but my head never actually hit the ground. It was more the whiplash effect that caused it. So if you're not sure you have a concussion and then these symptoms start emerging, the most important thing is immediate rest. So that means getting away from the screen. That means taking the time off work if you can. Think about it this way: if you have a concussion and your symptoms are present and getting worse, it's important to take that time off right away to prevent them getting drawn out and drawn out and drawn out. There are some other things you can do. Hydration. Minimum of 2 liters of water a day. I would say 4 is probably more accurate. Healthy nutrition. If you are eating constantly throughout the day, what my specialist told me is eat every 2 hours to keep the blood glucose level really, really even and consistent. So that means healthy foods. Avoid sugar, because sugar will, again, spike the blood insulin. It's also a stimulant. Any stimulant is going to cause chemical reactions in the brain that can worsen the effects of concussion. So stay away from recreational drugs, stay away from stimulants, stay away from caffeine. So get rid of that morning coffee for now, which sucks, but you have to do it. No alcohol. Then things that you can take as supplements to help you get better. Up your protein intake, because that's the building block of your body. It helps you repair and recover. Glutamine is an amino acid that does the same thing. It helps support that protein uptake. Fish oils, they don't have to be specifically fish oils, but it's omega-3 and DHA that help with that recovery process. Vitamin B2 has been shown to... And is there another one that I'm missing? Those are the major ones. Consult a healthcare professional about what dosage is right for you. But with something like fish oils, they come in tablets that are very standard application. Same with vitamin D, right? So you get a good idea from reading the labels about how much is safe to take. Stay away from painkillers and anti-inflammatories. And if you do take them, keep track of how many. Because, and this is a personal family story, but I have a relative who is a young lady who had a very severe concussion. She took so many Tylenol, she now has permanent liver damage because she couldn't remember how many she had taken, and her pain was so severe that she kept taking them and taking them and taking them. And so now this very young lady who is still dealing with concussion symptoms is also dealing with a damaged liver that's going to last a lifetime. That's pretty scary. Other things that have been shown effective for concussion. So I talked a little bit about, maybe I didn't, maybe I talked to you about vestibular therapy before. So what's been shown to be very effective, links to papers as well afterwards online. I have some here if the folks who are here want to look at them afterwards. But researchers at the University of Calgary found that a combination of vestibular therapy, which is for the inner ear, which makes sense with dizziness symptoms, as well as cervical, so neck treatments, really helps speed up recovery. So vestibular therapy, you can wind up with an impact to the head, dislodging some of the crystals in your ear or causing nerve damage around the ear. That can cause some of the symptoms. So if you find a physiotherapist who specializes in vestibular rehab, that can be very, very helpful in speeding up recovery. Frequency-specific microcurrent is another treatment that's shown to be very beneficial. That's a microcurrent that is administered. You basically hold these pads in your hand and it's administered through the body. There's a concussion protocol that's run that helps reduce inflammation in the cells. That's been shown to be very beneficial. I've experienced that as beneficial myself. Cold laser therapy has, in some studies, shown to be helpful. In some people, it might exacerbate the symptoms, so that's something you should talk about with your medical practitioner. Isolation therapy, where you're basically like put in a pot of water and you float and have sensory deprivation, can help settle the brain down, provide relief from some of your symptoms, especially if you get sensory overload symptoms. So if lights bother you, if sound bothers you, then getting away from that. other things that if you don't want to go through all these therapies, if light's bothering you, wear sunglasses. Amber colored lenses in the sunglasses are particularly good if you're looking at screens for getting rid of the light that you need to diffuse in order to not have those symptoms as severe. Carry around earplugs so that when you're in an environment with a lot of noise, you can put them in. If you shouldn't return to driving until you're cleared by a medical professional, but if even being in a car is too much, try and minimize that as possible. Really, a lot of it is trying to minimize those irritants as much as possible so the brain has adequate rest and chance to recover. The more stimulants you're providing the brain, the more it has to work, the less time it has for healing. Most important thing is rest and really adequately providing energy for the brain. Concussion, more than anything, is a lack of energy to the brain because your body is trying to deal with the impact of this trauma, and then your appetite might be gone, so you might not be eating enough. Your sleep might be disrupted, so you might not be sleeping enough. It's important that you do not take sleep aids unless instructed to do so by a physician because they can have strange interactions as well with a concussion. So it's really, really something that it's going to be symptom dependent, but the more proactive you get in getting that adequate rest, nutrition, the sooner your symptoms will likely resolve. I hope that answers your question. Is there any further commentary there, Dad? Any further comments?
He says thanks.
Anything else? No? Okay, thank you. I know it was a little bit rambly. I definitely have trouble still with structuring A, B, C, D. That's why I have a pile of notes in front of me. Again, I'm going to post the links to the SCAD assessment. I'm going to post the link to the consensus statement and to the article about vestibular therapy. And I have those papers here for people to look at as well. Please feel free to contact me with any further questions. My name's Claire Lacey. You can find me on the Athlete Factory website or on Twitter at Claire Lacey AF or online on Facebook, Claire Lacey. You can also, anything you put on the nerd page, I'm sure the head nerds will forward to me, so be happy to take any questions you have. Thank you. Anyone want to look at any of the papers?
Sure, I think it's got done. It's crazy because, like, if this discussion had happened 2 years ago, like the concussion that I had during that oil drill bits co-ed game,
Oh yeah.
like I was like it took everything in me not to cry. Like I was hitting the head so hard, and I had to skate off and then came back, and like the fact that I skated the rest of that game is
Yeah.
dumb.
Well, for me, it was like that very first football scrimmage. Like I said, I was unconscious.
Yeah, what was that?
That was
Football scrimmage, right?
football scrimmage, the very first game I ever played in.
Oh, I remember that
I'm
now.
not sleeping.
Yeah.
I don't remember that at all.
There you go.
You mentioned that
was
before.
one of your, like, you were just out of fresh
That was
meat.
my very
And
first
all
game.
looking
We were
at you
all
being like,
seemed like
you're
just-
not allowed to play fresh meat anymore. But I remember that game, but I remember